Making patients better and keeping them healthy is not just about having a bed in a hospital anymore, and the proposals we're putting forward have taken this into account. The Trust has analysed the needs of the growing population in the region, and there will be more beds under the proposals. However, modern medical techniques mean patients no longer have to stay in hospital or have long hospital stays.
Over the last 30 years, the NHS has cut its beds by about 50%, which feels counterintuitive looking at the population growth. But when you take into consideration the change in medical practice over 30 years, so hip replacements used to come in and be in hospital for over a week. They're now staying in hospital for around 2 days. We've got sort of robotic surgery now and keyhole surgery, which means patients don't stay in hospital as long. And we used to prescribe bed rest for patients. We don't do that anymore either.
New and different ways of delivering healthcare at home and in the community are already taking place to prevent admissions unless absolutely necessary.
If you need to be in hospital, so you need treatment or you need investigations that can't be done in the community, or for instance you're acutely unwell and you need the investigations doing straight away, hospital is the right place for patients and will be for those situations. So there's no changing the fact that in the future patients will need to be admitted to hospital. But there's certainly patients where their medical treatment can happen at home, and it's much nicer for the patient if you can have all the care investigations done in your own surroundings, done at local community hospitals with doctors, nurses coming in that will be the same faces that they see on a daily basis. Then that's much nicer for patients. It's about having safe care, but in the best way for the patient, the most suitable way.
If you would like this film in another language, please do get in touch.